The way the process is done, once somebody is interested in going ahead, we would take a detailed history. We would do certain investigations, especially to check if the pancreas has its beta cells functioning to a certain extent at least, because with the surgery we are going to revive these beta cells and get them to function near normal or normally. Once the investigations are done and we ensure that the pancreas is functioning, then this is a sure shot for the success of the surgery. Then we would admit them one day earlier. All the anesthetic aspects are checked for fitness, for safety, including the heart and lungs and other systems in the body. These are all checked earlier. Then the surgery is done the next day laparoscopically. After surgery, the person would be observed in the surgical ICU overnight, and from the same day or the next day, they would be able to walk, go to the washroom, walk outside the room, in the room, and start having small amounts of liquids. The person usually needs to stay for 3 or 4 days in the hospital, after which they can go home and get back to work whenever they feel more comfortable with. There is no bed rest required for this, so there is no restriction from our side, and we encourage everyone to do good amount of breathing and walking and stay active. Follow the advice of our dietitian. For the first week you can stay on liquids, then gradually you get back to mashed foods, soft foods and normal food, and start eating your regular food which is at home. So that's how the person can get back to normalcy quite rapidly. We say that usually between 7 to 10 days you can be back at your normal work. For the first month, the best activity is walking. From the second month onwards, you can do exercises in the gym with toning of your muscles, which is very important, and any other weights that you can do. One can swim, one can go cycling, one can do any other sports or games. All this can start from the second month, and you actually can get back to complete normalcy or better than before activity. We have a person who we operated about 12 years ago. He lives in the US and he has run 11 marathons in this time. So it can be as good as that. You can be as fit as that after this surgery and after getting rid of the disease of diabetes.